Good day, everybody. Let's get ready for it, and let's let this video begin. I wanna play live music and feel alive, but your silence is deafening. Their presence is threatening. So say something. Say something. And people call me brave for speaking out and speaking up. It's not that I am brave, it's just that I don't give a fuck. Why should I care about the things that I say? I won't stay silent, I won't be quiet. And why should I care about the things that I say? I was never cool enough to get any real airplay. Wow, that's for sure when it's coming from me. Let's listen to this doctor. This is Dr. Corey, and he is telling the Senate what is going on here. And let's get ready for this.
Our next witness is here in person, Dr. Pierre Corey. Dr. Corey is the former Associate Professor and Chief of the Critical Care Service and Medical Director of the Trauma and Life Support Center at the University of Wisconsin, and recently joined the ICU service at Aurora St. Luke Medical Center in Milwaukee. He is board certified in critical medicine, pulmonary diseases, and internal medicine. Dr. Corey has traveled across multiple states in the U.S. to care for COVID-19 patients throughout the pandemic. He is also the president of the Frontline COVID-19 Critical Care Alliance, a nonprofit organization of critical care specialists led by Professor.
After you listen to this individual, you are going to see why Dr. Fauci and Dr. Tama and all the rest of them, including Doug Ford, Justin Trudeau, and every one of your politicians out here are nothing but a fucking fraud.
Eric, whose mission over the last 9 months is focused on the research and development of effective treatment protocols for COVID-19 using repurposed drugs. He received his MD from St. George's University School of Medicine, and I'll only add that we added Dr. Corey very late to our hearing in May, because I'd heard of his development of, anti-inflammatory steroids in critical care on COVID. And Dr. Corey, I have to tell you, I've had doctors come up to me and thank me for holding that hearing where they listened to you, changed their thinking. They believe they've saved their patients' lives because of your testimony at that hearing. I hope your testimony will be as impactful today. Dr. Corey.
Senator, thank you, and thank you for holding this hearing. I just want to start out, I didn't think I'd have to say this, but I want to register my offense at the ranking member's opening statement. I was discredited as a politician. I am a physician and a man of science. I have done nothing but commit myself to scientific truth and the care of patients. And to hear that I'm here because of a political angle, I am not a politician, I'm a physician. I want to start out by saying that I'm not speaking as an individual, I'm speaking on behalf of the organization that I'm a part of. We are a group of some of the most highly published physicians in the world. We have near 2,000 peer-reviewed publications among us, led by Professor Paul Marik, who's our intellectual leader. We came together early on in the pandemic, and all we have sought is to review the world's literature on every facet of this disease, trying to develop effective protocols. You just mentioned that I was here in May, and I recommended that it was critical that we use corticosteroids in this disease, when all of the national and international healthcare organizations said we cannot use those. That turned out to be a life-saving recommendation. I am here again today.
And why would they say that? Because they know it saves lives. There's several other things against this pandemic that also saves lives. This is not just your chemical doctor. This is not just some flake coming out here. This is a real scientist.
With a new recommendation. In the last 9 months, in our review of all of the literature as a group, again, we are some of the most highly published physicians in our specialty and the world. We have done nothing but try to figure out how to identify a repurposed and available drug to treat this illness. We have now come to the conclusion, after 9 months, and I have to point out I am severely troubled by the fact that the NIH, the FDA, and the CDC, I do not know of any task force that was assigned or compiled to review repurposed drugs in an attempt to treat this disease. Everything has been...
Well, there's a reason for that. Because they knew back in 2019, they already had the second pandemic, I guess, budget for it all, because they already knew what they were going to do because it was a setup. Other than that, let's remember the World Trade Center would have been attacked and they killed 5,000 people. America's up to 250,000 people. Russia over 14,000 now. And nobody is doing nothing against the country. Let's find out why.
Novel and or expensive pharmaceutically engineered drugs. Things like tocilizumab and remdesivir and monoclonal antibodies and vaccines. We have 100 years of medicine development. We know, we are expert in all the medicines we use, and I do not know of a task force that has been focused on repurposed drugs. I will tell you that my group and our organization, I will say that we have filled that void. That is all we have done, is focus on the things we know and things we do. And I'm here to tell you, Dr. Reiter, he just presented. He has one study of the many that I want to talk about. And I want to talk about that we have a solution to this crisis. There is a drug that is proving to be of miraculous impact. And when I say miracle, I do not use that term lightly. And I don't want to be sensationalized when I say that. That is a scientific recommendation based on mountains of data that has emerged in the last 3 months. When I am told, and I just had to hear this in the opening sentence, that we are touting things that are not FDA or NIH recommended, let me be clear. The NIH, their recommendation on ivermectin, which is to not use it outside of controlled trials, is from August 27th. We are now in December. This is 3 to 4 months later. Mountains of data have emerged from many centers and countries around the world showing the miraculous effectiveness of ivermectin. It basically...
Ivermectin. Remember that name, ivermectin, because that is what he is talking about of all their scientists that they have done for COVID-19. And this is your scientists, not your fake governments.
Obliterates transmission of this virus. If you take it, you will not get sick. I want to...
Dad's still a speed demon. Shingles doesn't care.
You will not get sick.
Get 12 of the hottest TV networks.
I guess during this time we all know how YouTube is.
Your free trial.
Trying to make money off of other people.
I want to briefly summarize the data. My manuscript, again, published by some of the most... We have contributed more to the medical knowledge of our specialty in our careers than anyone else can claim as a group. And our manuscript, which was posted on Medicine Preprint Server, details all of this evidence. I want to briefly summarize it. Number one, we have evidence that ivermectin is effective not only in prophylaxis, in the prevention. If you take it, you will not get sick. We just came across a trial last night from Argentina by the lead investigator of ivermectin in Argentina, Dr. Hector Carvalho. They prophylaxed 800 healthcare workers. Not one got sick. In the 400 that they didn't prophylax with ivermectin.
What more do you need to say, folks? We have an opportunity of knowing that our government is up to $381 billion so far. And where the fuck has that money really went? Because it has not gone anywhere really special. Because what they're saying it equals up to is not even $3 billion so far. They can make it all up as far as they want. But at the most, there has to be no more than 15 billion missing. But we all know now your reality of what is happening for this pandemic. And your government wants to isolate you. Your government wants to have isolation camps. Your government wants to put you on curfews. While we have this miracle drug that this professional doctor is telling you about. This is the last video for YouTube. I know it probably won't even be showing. This is how they are out here today. And if they take this off of here, it's going only on the parlor anyways. So let's get ready, folks.